Well, Don and I tend to take turns running to the emergency room when our physician tells us that we need to go. Don had passed out a couple of times one night while we were holding hands in prayer with friends at Christmas time.
With Mitch Butter, with
Philip
Kevin
Burns,
Spiegel,
Philip
with
Burns.
Philip Burns, Charlie Longer. We were covered with, and a minister, and a nurse. So I had everything covered. But
Well, he passed out, and they called the ambulance
Yeah.
to get Don here to the emergency room, and lo and behold, it was more medication, blood pressure medication that he needed because he was getting well, and taking the medicine and following the doctor's instructions. So they reduced that amount of medicine, and he's just fine. But within a few weeks, I was feeling terrible, and my doctor, Dr. Cook, said, take a blood test. And afterwards, Don and I ran off to Huntsville on a business trip. We came back about halfway, and I got a call from him saying, go to the emergency room. Go. Where are you? What city are you in? Go to well, luckily we were close enough to Erlanger that we came here. Once again, Dr. Campbell, the chief of cardiology, met us and said, oh, it's your turn to come to the emergency room. Now, this has only happened twice. It's not like this is an annual event for us. But it was dangerously low saline and close enough to a coma that I needed emergency care right away. Well, of course, I had all the teasing that I wanted the same attention that Don was getting. But Dr. Campbell was wonderful to not only to talk to Don one more time, but to me about what we should be doing, not only the medication, but the diet. And we gained a great deal of respect for the chief of cardiology, who was right there with us in the emergency room. In both opportunities for us to be in the emergency room, the staff was tremendous. They were right there beside us, concerned about any pain, concerned about physical needs, and then also helping us with the emotional fright that we were going through. So for a couple of old people, we owe that life longevity to Erlanger and the physicians and the staff and the care that we've had.
That's true.
That's true.
And so far, it's worked, and we're hoping it continues to work. But I will guarantee you that Erlanger has saved my life for sure, a couple times, and so I'm very thankful for everything. And it's all because you all care, and it's obvious to me.
And advance in medicine that we have at Erlanger, a tremendous advance, from the robotics to tremendous administration who has continued to bring in leading physicians from around the country. We can't say enough about the caliber of physicians' care that we have at Erlanger.
But these guys are always going to be my heroes.